Well, welcome everyone, and thank you for joining us for our first session of our Volunteer Management Basics series. This series is presented by the Michigan Community Service Commission. And what the Michigan Community Service Commission does is that we support volunteerism statewide in nonprofits, in organizations, community centers, in cities. And we use service as a means to be able to help communities overcome challenges through the power of people. And when we did a quick introduction, everyone here, I was so impressed about how how great your and how important your missions are and the purpose of your work. And I can tell you, I've been in volunteer management myself for 25 years, and I am always blown away by the impact that volunteers make. So I want to say thank you from the bottom of my heart to you for what you do. Really appreciate you. I am helped today by my partner, and her name is Katie Alexander. You can say hi, Katie. She's letting people in for me.
Hi, everyone. Yeah, I'm in AmeriCorps Vista with the Michigan Community Service Commission, and I will be monitoring the chat today. So if you have any questions, feel free to put them in there.
Yeah. Thank you. Thank you so much. Yeah, couldn't do my work without Katie. I love Katie. So I'm gonna go ahead and get started here. So yes, you could please use the chat. Thank you for reminding me of that. And then we'll have some time afterwards. I wanted to also share with you, usually I send out the slides afterwards. And what I'm going to do a little differently this time is that, and it probably won't be today, it'll probably be tomorrow or Monday. I'm going to send you a link to our learning management system. This is a brand new system that we have, and we will upload this session, and then there's other sessions that we've recorded. Plus, they have a lot of very short sessions that are on just about any kind of topic you could think of that you have access to once you get into that learning management system. But you can utilize all of those trainings to your benefit. And we can also make sure that you have access to this recording. So we are, like I said, we're delighted to have you with us. This is the Volunteer Management Basic Series. So it's really kind of like if you're an experienced volunteer management coordinator, it's a way to kind of like brush up on skills, kind of go back to the basics. If you're new in this role or newer in this role and you're like, hey, am I doing everything I should be doing? This is a great place for you to be. And I want to say something too about best practices. We recognize that best practices are not always applicable across the board. Some things can be easy in a small nonprofit and next to impossible um, in a large nonprofit. Just a moment. Okay, sorry. I work from home and my daughter is on her way to an interview and she's needed something in the room. So sorry
Sorry,
about that.
is
Okay,
the
so
chat
I'm
disabled for
sorry.
anybody else? Sorry, does
Oh,
the
the
chat?
chat. Oh my gosh. Let's see. Maybe I can have
Maybe it's just me.
no, I don't think it's just you.
Yeah,
Okay.
it's disabled.
Okay.
Oh, it is. Okay, I just fixed it.
Okay.
There is
Sorry.
some
I didn't want to
setting
interrupt
on
you,
there.
but I was like, I don't know how to tell her without the chat.
You did. Yeah. Sorry about that, everyone. It's on now. Sorry about that. I thought I had checked it and I went the wrong place. So my bad. Okay. So with that, I wanted to tell you, just do a quick reminder of the other sessions here in the Volunteer Management Basic Series. So today is impactful volunteer roles. Next is volunteer recruitment. That's always a very positive one, a very popular one. Volunteer screening, And that volunteer screening is actually a recorded one, kind of a bonus in our sessions. And that was done by a partner at MSU Extension. She's phenomenal, but it is recorded. And then we'll be back to live ones with interview and placement, orientation and training, and then engaging and supporting volunteers. So it kind of goes through the whole kind of life cycle of a volunteer. So with that, make sure that you have those. I'll do some reminders and things like that. And if you haven't had a chance to sign up for those other ones, it's the same link that I sent you to remind you of this meeting. Okay. So with that, so these are funded by, it was originally funded by something called the Volunteer Generation Fund. We no longer have that, but the work that was done under that grant, we always like to acknowledge that because it was AmeriCorps funding, and it was, we're very passionate about the kind of work that we do, and this Volunteer Generation Fund really got at the heart of what we want to do for nonprofits, which is to build your capacity to be able to utilize volunteers and to be able to expand the services that you offer through volunteerism. So I did a quick introduction. We talked a little bit about each other. I love that. I'm going to just go ahead and let's talk about our learning objectives. So what I want to do is help you kind of get into the mindset of thinking beyond your immediate needs, your short-term needs. Short-term needs are important, but in our roles, we really need to think long-term. We need to be visionaries for our organization. So I'm going to, throughout the training, talk about how do you think big? How do you dream big? And then we're going to talk about the nuts and bolts of things like understanding the labor laws that impact volunteer management. You know, we are kind of a small human resources for our unpaid work staff. And then we're going to talk about risk management tips. We're going to talk about the paid versus volunteer roles and the value of volunteer position descriptions, which if you've ever been in one of my other trainings, I always talk about those as like the basics. It's so very important. And then what should be in a position description? I've got that for you. And then how do you maintain your volunteer position descriptions? What's kind of like a good practice for that? And then I've got some tools to support our learning today, which I'll send out later. So, developing those meaningful roles, I want you to think about this. First, one of the basic things is to really understand what the needs of the organization are, you know, assessing the needs. I'm going to talk about this later, but really, it's not something you just do in your office by yourself. And you're not an island of yourself. You're really there to serve your organization and understand your organization's internal and external customers or stakeholders. So think about how you can assess those needs. And some things to think about are, you know, to jot down like what are your organization's challenges and really get in to understand those. I spent a lot of time in healthcare, and one of the things that became clear to me is that we would start initiatives, and a lot of those initiatives would fail. And why would they fail? Well, one, they couldn't sustain it. They were good things. They were things that promoted safety. They were things that promoted um, uh, patient engagement, but they didn't have the people power behind it. And so that's where we come in. We, as volunteer coordinators, volunteer managers, directors of volunteer services, we can put the people and the sustainability behind initiatives to keep things going. And so understand those challenges. And then what are your gaps that exist because of capacity or limited funding? And one of the questions that I asked later is if you were to ask your teammates, whether it's in fundraising, whether it's your executive director, whether it's a board member, whether it's a program person. If you had $1 million or unlimited resources, what would we accomplish? Well, that's your ticket, because guess what? That's what we do is we bring in resources, and sometimes they're resources that an organization cannot afford on their own. So to think about it that way, you are in many ways one of the most important people in the organization, because you basically can offset any cost that they invest in you by the power and the savings that volunteers can bring in, and the talent. So, understanding from the volunteer point of view, we to be able to do this, we also have to understand what motivates them and how to balance their needs with the organizational needs. I'm sure you've all been here, but I used to have some really popular programs. They were with babies. Everybody loves a baby. But I would get all these people in, and everybody wants to hold a baby. Well, not everybody can hold a baby. We don't have that many babies. And, we need them in other places. So it's like balancing their needs with the organization's needs, and being able to package things in a way, and to be able to promote things in a way that balances that, and how to bring them along to fill the gaps. How do you incorporate like maybe one element that is not as attractive in a job or a position, and kind of package it all together so it's one part of it. And just like us, we all have things that one element of our job is not that exciting, but we have to do it. Volunteers generally are good about that too. And so, and then how to reach for the stars to bring in those talents and those resources. We're going to during the series, we're going to talk a lot about that. So let's talk about laws. This is kind of the not as exciting part of volunteer management. As I mentioned, you are kind of a volunteer or a human resource department. Even though you don't employ people, you have to be aware of the labor laws. So there's the Fair Labor Standards Act, and it allows individuals to volunteer for a nonprofit charitable organization at schools. You cannot have volunteers in your for-profit carpet cleaning business. That's an employee. and and then so that law expressly prohibits volunteering for-profit organizations. The interesting thing about this is some of us have like thrift shops. We have some organizations have a for-profit wing to it. So thinking about that, making sure that you draw that line. There's no reason why a volunteer can't volunteer in a thrift shop. I'm not saying that, but understand what if you're in that situation where you have a for-profit wing and a nonprofit wing, that you keep those separate. Nonprofits cannot allow an employee to volunteer in the same capacity as an employee. As they're employed. So for example, when I was in healthcare, this would happen quite a bit. I would have nurses who would want to go and volunteer in their department to help with like a school project or something like that that they had going on. And we couldn't do that. You have to volunteer in another area. Their access, their knowledge, their function is completely different. So even if they're like the best nurse in the world, a patient's thing goes off and they need a rapid code, they're not there in that capacity as a code person. They shouldn't be doing that. They should go get help. And I know that sounds like, oh my gosh, but a hospital is ready for that. They could do that. But that shows like kind of how extreme that is. And it might be easy to say, well, they should be able to look up patient information. I had volunteers that unfortunately had done a little bit of that, and then we had to be really, really careful of that line of scope and things like that. So nothing wrong with it. They just can't do the same kind of things that they're doing. So that really gets to what we're going to talk about with a position description and how that protects you, how that protects the organization. And then volunteers can supplement staff, but you can't replace paid staff. And I'm sure we've all heard that before, but I'll give you some good examples. So let's say an employee is going out on maternity leave. And you think, well, I've got Jane. She's a great volunteer. She did this kind of work when she was before she retired. She can just slide in and do this person's job. Absolutely not. So a volunteer could do part of the job but not the whole job. I'll give you a great example of this. When I was in healthcare again, we had volunteers that did about 70% of the patient discharges. So they would wheel people out in a wheelchair. That's fine, except we had paid staff, and they were even unionized staff that would also do that. But the real difference was those paid staff would do the interdepartment transfers. So like if a patient was in the ER and we brought them up to a med surge floor, our volunteers never did any of that. It was only after the patient was discharged that they could give them a wheelchair ride or a guest. Lots of times they have guests that need that kind of help, and that's perfectly fine. So you can do part of it, but not all of it. So let's go back to our friend who was going out on maternity leave. Let's say that there was a certain piece of the job that absolutely had to be done. Let's say it was answering phones, okay? It's okay, a volunteer could do that, but other paid staff are going to have to do some of the other things so that there is a clear delineation between what was paid work and what was volunteer work. And you cannot, I'm sorry, that should not say display staff roles, displace. So if you unfortunately had a big, budget shortfall, and your executive director comes to you and says, hey, we're going to eliminate all of our staff and I want you to go find volunteers to replace them. You can't do that. That can be perceived as a labor law violation, and you may actually have to go back and pay those individuals. That has happened in some organizations. I'm not saying it's going to happen to you if there was a little thing that was like, well, maybe we shouldn't have done that, but it is something to be aware of. So
Melissa,
again,
there was a
go
question.
ahead.
I'm sorry, there was a question about that. Do you want me to wait till the end, or do you want me to ask
Yeah,
it now?
let's take a look at that.
Okay.
Okay. So could somebody kind of summarize this?
Sure. It said, we have a volunteer who is helping with maintenance and custodial, and they are now hired as a custodian. If painting isn't in her job description, can she do things like that?
But she's now an employee?
Correct. Yep. So she was a volunteer helping with maintenance and custodial work, and now she is hired as a
Oh,
custodian.
yeah. No, that's fine. If she's now in the function of a paid employee, but let's say you brought in another volunteer and they may help with painting, or that might be, yeah, I think that's fine. The role of a maintenance person is probably all of this. And then if they're helped in a certain way, like, okay, I'm going to give you a great example. We all have boilers, we have heating systems. I know a guy who is licensed in like just about every kind of element of HVAC. And that's what he does for nonprofits. There's a bunch of nonprofits that he services, and he makes sure that he does their annual maintenance on it, and make sure if there's a problem, he fixes it. He's just this guy who probably knows more about this kind of stuff than most other people I could ever think of. Anyway, it's okay. He could do that. That's fine. But then that person who has the overall facility, he's not fixing the roof. He's not getting bids for fixing things. He's not vetting contractors. So that's fine. Did that answer the question?
I believe so.
Okay, great. Okay. Okay, so and just so you know, I'm not seeing the chat, so it's when Katie tells me there's something in the chat, so that's helpful. So let's talk about young people because a lot of the labor laws that you need to be aware of do pertain to youth volunteers. You may or may not have a youth volunteer program, but this is good stuff to know. So children 14 and older may volunteer, or in limited cases, they can have employment. I'm not going to go over the employment parts. There are some weird things about corn husking. I don't know, but they're probably kind of older laws. But there's some things that you should know. Even if you have a volunteer who is like 10 years old and they are going to come into your organization and be with their parent, that's actually technically a labor law violation. Now, there are some ways that you could do some things where if young people want to volunteer, that you could do it in a safe way. Like, for example, if they're doing a service, an active service, like at their school or their church or at home, and they bring something in, that's perfectly fine. But it can be considered a labor law violation. And the person who okayed it, approved it, which might be you as the volunteer services coordinator, could be held liable for that, and that's a misdemeanor if they're hurt. So think about this. In some ways, like let's say I didn't hear anybody say that you were from a food program, but like food programs, the ones I'm familiar with, they have big time equipment. They've got forklifts, they've got big, huge pallets of food. I mean, it's a warehouse. And it might sound nice to bring in a 5-year-old or a 6-year-old to help volunteer. That might sound good. It might, hey, what could be the harm? But it could be very harmful. I mean, if they're not of the immaturity, they don't have that, they don't have the capabilities that like a 16-year-old or an 18-year-old would have. So think about that. The other thing is hours are very limited. The main thing is that during the school year, it's like up to 20 hours a week that they could be employed. And there's some times. So anytime that school is not in, school is in session, they should not be volunteering. Now I say that, and then we know that sometimes schools have agreements with organizations. I had these with several ISDs where we would do experiential learning, and it was very different. They were there with a teacher, they were there with it was structured of what they were going to be doing. It was part of their curriculum. That's different. But if I just had a kid from a local school who wanted to come in at 9 o'clock in the morning and volunteer during the day, that could be a problem. I actually kind of, to be perfectly honest, I shied away from it even with homeschooled kids so that there wasn't even a hint of it. I'm not saying you do that, but that's something to be considered. I didn't want it to be set up that I could be taking away valuable learning time for them to be in service. So that's something you deal with on your own, but that was just my experience and wanted to be sure of that. So work permits used to be required for volunteering and it's no longer required, but I would always make sure that I stayed away from those max hours. I typically only let youth volunteers volunteer like once a week. And part of it was, to be perfectly honest, is not having too much time there, not having too much familiarity, that it still could maintain like a professional relationship with them, and that they get bored. So they get bored and you end up with a little more of a management problem. I'm not saying that that's the rule, but that you need to follow, but that was just my advice. So so then
Melissa, sorry, we
okay.
just had one question about the child labor laws.
Oh,
And
sure.
with deschooled children, because their hours vary. So they wanted to know about child labor laws with deschooled children.
Oh, D school, do you mean preschool?
they said deschooled. I don't know if that's, oh, gosh.
Your hours may vary. Who was it that asked about that?
It was.
Oh, same as homeschool. Oh, I got you. Okay, I just hadn't heard that term before. I'm sorry. So you know what? I guess a couple of things. Um, your organization has to have age limits that you're comfortable with, and that's perfectly okay. Um, oh, we work with customers who are job ready and have been out of the workforce. Yeah. So, oh, okay, that's a different question, sorry. So and same as a homeschooled. So that has to be an that has to, one, be something that your organization is comfortable with. There is nothing wrong with saying a homeschool or a deschooled child cannot be in your organization at 10 o'clock in the morning. There could be things that there could be an agreement that was arranged where they're doing a learning piece, things like that. So it's really something it's really something that your organization has to examine and make sure that, one, you're not taking a child out of a classroom or a learning situation. And then the other thing is that if you are, what are the outcomes? What is it that they're learning? Is it an experiential learning? Is it a co-op? If that's the case, there's usually an agreement there, and that's in place. And I'm not the expert at that. I've done that, but a lot of times, actually, the ISD, the local ISD was the one who helped with that. And I'm sorry, I just don't know a lot about deschooled children. I'm not an expert in that, so I'm sorry. Um, and then, Ashley's question about the Michigan Rehabilitation Services, the Michigan work groups. Oh my gosh, I love those. I really always loved working with people who might have had a disability that were looking to get back into the workforce, or it was just someone who was looking to get back into the workforce. How could we design something? Those are great ways to help people uh, really get back into and get the experience that they need to move on to the next level. And it's a safe place to do it. Volunteering, they're going to try something and maybe something works, maybe it doesn't. And then usually they have a job coach, and at least with the Michigan rehabilitation, which I always loved job coaches. Job coaches, to me, are like the best thing in the world, because you could really help someone explore something, and then they have somebody who's there to help. So I would bring the job coach along just the same as I would with the volunteer, to talk about what the responsibilities are and things like that. I hope that answers your question there. Um, if I didn't, feel free to come off of mute and just let me know. Okay, I'm going to move on to some risk management tips. So every time that I've ever created a new volunteer role or assessed kind of where we are, I've always considered, what are our risk management issues? And I've got some tips for you. So the first thing is, just always kind of having your ears to the floor in terms of, what are the risk management issues that we need to be aware of, and what are the identifications of those. So sometimes they can be things like, you know, the issue with the deschooled kids. You're thinking about them and you're thinking, well, there could be a way to incorporate them into our program. Maybe a great idea. There may have to be some things that we have to be aware of. And then this is a good place to, kind of start thinking about it. So risk awareness and identification. Sometimes, like in some of the things that I've done, it's been, big things like HIPAA, or, are we potentially exposing them to a bloodborne pathogen? Those are kind of big things. And a lot of times it's like, health and safety, and then limiting the exposure of the organization to a potential lawsuit. Confidentiality could be another area. That's usually a big one in nonprofits is client confidentiality. And then there's ways to mitigate those risks. So you kind of have to weigh those out in terms of, what could possibly happen. And I always call this like the what if. What if you had them working outside and they got hit by a car? What if you had them, meeting with a client and then they decided to go to the news about that? What are the things that you could do to mitigate that? It could be a confidentiality agreement, it could be training, it could be a lot of things like that. So think about those elements. But this is kind of how it works. And I always think about a funnel because right up here, you're thinking about all the what ifs that could happen. You could have a garden program and think, well, what if they're using a tractor and the tractor falls over on them? Well, I mean, are there appropriate ways to mitigate that risk? Is there training? Is there making sure that the land is flat? A lot of things like that. Is there a liability insurance policy? Is there a liability waiver that you can sign? The next thing, like I said, is insurance. So we should, if possible, have an insurance policy that would cover volunteer liability. And I'm going to say this because I know I had a very well-meaning director once put an insurance policy in when I was at United Way. And guess what? We found out that the insurance policy, it was a great idea to get one, but you got to look at the fine print. It only covered things that were in the four walls of my little office. Most of the work that we did was not in my office. The work that we were looking to have an insurance policy cover was like out in a neighborhood when we were doing a cleanup or a painting job or, anything like that that you can think of. So be careful about what and where your insurance policy covers. And then to talk to your insurance provider and be real clear on that. For example, RSVP, they have an amazing insurance policy, some of them do, where it will cover a volunteer when they're driving to the organization. Let's say they're driving to the organization and someone hits them and then their car is out of commission, or God forbid they really got hurt. It could provide some coverage for that. Now, normally, I don't think a volunteer would look to you for liability on that, but that's something to think about. Or if they had a slip and fall in the organization, that falls tend to be a really big issue. So think about that and what that would cover. And then policies. Having setting good expectations for providing clear direction on things. Like, for example, let's talk about a garden program with a tractor. I was a farm girl and some of our land, was hilly. I've known of people who have unfortunately had really serious injuries and fatal injuries from a tractor falling over on them. So what are the things that you could do in your training and in your policies and procedures that you review training, you state, where a tractor is appropriate to use, where it's not, how it's going to be used, things like that. And that could be, even as simple as a lawnmower. A lawnmower could be very dangerous, teaching someone not to put their hand down there if they think that there's something caught in the machine. Think about that. But those policies will also direct that, things like a volunteer can't start serving and they're not a volunteer of your organization until they've completed their safety training or their orientation, things like that. So think about that. And then modifying activities. So there's no reason why maybe a volunteer can't be on the tractor, but modifying the activities. Like, for example, volunteers are only allowed to be in this garden area with the tractor because it's on a flat surface. Volunteers, for example, I would do a lot of things that would involve patient confidentiality. So maybe there was certain things that you would protect, and they would only be able to see what they needed to see. And you could do that in your organization as well. You can look to see how do you limit your exposure to elite confidentiality for your patients, or something along those lines. Your organizations much better than I do, but having behavior standards, having clear processes for, like, you don't go to the media, you don't represent the organization on behalf of the media. You come to the director, and let's say, and this has happened to me, sometimes they have gone to the media and they didn't go through the proper channels to ask questions, and it's a little embarrassing when you're the person that they're like they should have gone to, and you didn't know that they were going to. That kind of stuff happens. But having those kind of policies and procedures in place where you can talk about that and you can educate people about those things are good things. But it does mitigate some of those risks and addresses issues. You can address issues to limit damage. I'm going to give you a great example. When I was in healthcare working with young people, we would say to the volunteers, your experience with them is only here in the hospital. You never see them outside. Even if you see them outside the hospital, you don't say, oh, yeah, I remember you. They can come to you. This was also something that was from when I worked in a shelter. Uh, we would see people once in a while that, maybe I'd known from the shelter, they had been a client, and we don't say, hey, I remember you from the shelter. No, they can come to me and say, I remember you when I lived in the shelter. That's fine. But, just to understand that, and the scripting that goes along with that, and helping people understand what those are. So you can address the risk, and you can make sure that people understand behaviorally what they're supposed to do and what they're not supposed to do. And I'm a big fan of scripting. I talk about that in future sessions to help kind of help people not stumble in those moments, to know how to um, get out of the moment safely, and to be able to do it in a way that protects the organization, and it's a way to respect them as well. So the
Hey,
next thing,
Melissa, sorry, we just had a question from Jessica.
yeah.
She asked if you're going to go over the importance of board coverage. Some organizations may not realize the risks involved with serving on a
Oh,
board.
yeah.
Okay.
Oh, yeah, I can do that. Okay. So, yes, board coverage. It's oh gosh, I forgot what it's called. There's a board liability. There's a name for it. And every organization absolutely should have that. It covers your board members from being personally sued, should a decision or something happen. And as a board member, you don't have, I mean, you have to trust that the executive that you've hired is putting in good procedures and things like that. For example, here's a great example. If if there was a embezzlement, unfortunately, that does happen sometimes, and a lot of times they can look to blame the board for that, and the board could be sued for it, especially if they were grants, federal grants, things like that, where they could hold the board liable for that. So having insurance for kind of those kind of misdeeds, having, God forbid, there was a harm to a patient from someone. Uh, Unfortunately, sometimes that happens, and a patient or a client could sue the organization and board members individually, and you want that officers and liability insurance. That's what it's called. And you want that insurance in place so that their service is protected. Absolutely. But you also want to make sure that board members understand, what their responsibility is and having good, clear outcomes, which kind of gets to the position descriptions. I believe in having a handbook of all of those policies and procedures, and then also having a position description that supports all of your risk management issues that come up. I think it's extremely important. And we're going to talk about that next. So where that kind of comes in, it's risk management, volunteer safety and engagement, and then the position description. That's kind of how it all comes together. So I've got some slides later on that talk specifically about what should be in a position description, but this is some of the other things about paid work versus volunteer work that I want to share with you. And some of the labor laws do impact both paid and volunteer work. And it's especially in the area of youth volunteerism, like I talked to you about, like when a student should be in school, the number of hours that they're spending. But there's also things like with the Americans with Disability Act, you should be able to make reasonable accommodations for individuals who have a disability. However, there's some things to know about. You don't always know or see that someone has a disability. And there's sometimes you want to just get out in front of it. And that's kind of how I have always looked at this. So one of the things that I would always say, I would always put this as like one of the first things that people see. I love working with people with disabilities, but you have to know, and for it to be successful, it's a partnership between the organization, you as that liaison, and the volunteer and their supports. So one of the things that I would say on our application, we would do group interviews, and I would say, I don't really want the person who has a disability to be in the mix of all that. They shouldn't have to tell anybody else about their disability. I think that to me is somewhat confidential, and it's also hard to do that planning with a bunch of people that have no business hearing that. So I would say, if you have a special circumstance, there's something you need to talk with us about before you fill out the application. If you need accommodations, please reach out to us first. And you know what we would do, even before they even fill out the application, sometimes we'd say, well, why don't you come in and we'll sit down and we'll talk. If you want to bring your person from the disability network in, let's do this. Let's talk about it. I have engaged with people who are blind. I had 3 or 4 blind volunteers. I had people who had epilepsy. I had people who had been a patient like in origami. It's a brain injury network. And these were magnificent people who had just something really terrible happened to them. And they were trying to get back to where they were, or back to a new life. So I was always really proud of the fact that we were able to work with those folks. But you know what? The key was a partnership. And so could we make reasonable accommodations? And what were those accommodations? We did it all the time. But guess what? We did it one-on-one. It was a partnership. It was really never that big of a deal. But it always seemed to be when we weren't told about these that the problems came up. That kind of makes sense. I mean, I had a man who was autistic, and he wanted to be in the emergency room. And in our college program, we let him go in the emergency room. That was about the worst place for him to be. And it wasn't successful. It wasn't good for anyone. but we were able to backtrack and do some work with him, and we got him to a great place. He was a great volunteer. So think about that. Don't ever shy away from somebody who has a disability that wants to be able to give. They can probably give a lot, and sometimes they need help. Sometimes they need to come into the interview with some support. Sometimes you have to have one or two meetings with them, but figure out if they can bring in their support to do that and then just work it out. There are times when things were not safe for them and we just had to be honest. This is not safe. This is what is going to happen and or what could happen. And I'm not sure that the risk is, maybe at some point you'll be ready for this, but maybe not. Always handled with respect, but in confidentiality. And then we would just build it out. And we would really actually build out just a position description right for them. So that was totally okay. Obviously, sexual harassment, not okay for an employee, not okay for a volunteer to deal with that. We would have an actual policy about that mirrored the employee policy on that. Occupational Health Safety Act, OSHA, applies, especially in things like with healthcare and firefighting services. Those are two volunteer areas where I know that it's pretty important. They still have access to MDS safety sheets for things like Dawn dishwashing detergent. There's an MDS safety sheet for any kind of materials that they work with. And so it's okay that it's held in an electronic form, but if they ask for it, they should be able to be given that. Here's something else to be careful of. Any payments given by the organization could potentially make a volunteer subject to employment laws. They can be viewed as an employee. So if you're like a Vista, which Katie is, she receives something called a stipend. A stipend's okay. A reimbursement of expenses are okay. But if you're giving them, a gift is okay. I think in one organization we gave a gift certificate, that's fine. But if you're giving them a payment to serve, be careful of what it's called, that it's clear that it's a stipend. She has a living stipend, for example, but it's not her paycheck. So the other thing is labor laws dictate the number of hours an employee can work. Technically, and Katie probably won't like me to say this, but technically she's on 24/7. Peace Corps volunteers, they work 24/7. NCCC, they work 24/7. Don't worry, Katie, I'm not going to make you work 24/7. But
No problem.
some of those national programs can. Chances are you're not going to want your volunteers working that many hours either, but there is not as that's not something that's regulated except with those young people. And then obviously organizations have to budget for the number of employees based on funds available. But that's the beauty of volunteerism, is that you can have as many volunteers as you possibly can support, and you're not tied to a budget. So volunteers also give up their time without the expectation of compensation or a promise of future employment. We would have a statement that is very clear that just because you volunteer, it doesn't mean that you're going to be compensated for your work. It doesn't mean that you're going to be given future employment or even a priority of employment. I think sometimes that's really important. There's some areas where people do think if I volunteer, I'm going to get a leg up. In some organizations, you can do that, and in others, you can't. So being clear with that. Like I said, 24 hours a day. I won't do that to Katie, I promise. But organizations can host an unlimited number of volunteers. And a lot of times you can bring in the kind of volunteers and the talent that you can't afford to hire. And then volunteers, when they're viewed as helpers and assistants to paid staff, if that's like your organization's viewpoint, you may have to work on moving the needle on that so that you really can take full advantage of what the impact of a volunteer can be. And that to also maybe think about too, your board members are also volunteers, and are they held to the same standards as a regular volunteer? You can work through that in your organizations, but it's kind of in the organization, the large organization I belong to, the volunteer board members said to the organization, if that volunteer is held to that standard, I also need to be held to that standard. So think about that. And let's move on. So going back to now thinking about the risk management, thinking about those labor laws, kind of the kind of stuff you don't always want to deal with. But then when you're thinking about and you're planning those volunteer roles, keep those things in mind. But then you kind of can start to dream and think big about where could this position go? Where could the impact of volunteers go? And, how do you do that? And this is kind of a quick roadmap. One, you need leadership buy-in. So I would suggest that if you're thinking about expanding volunteer services in your organization, start with your executive director. And you want his or her buy-in. You want him or her to understand and believe in the fact that there's some really cool things that we could do. And asking him or her that question about, hey, if we had unlimited resources, what would we do? And I love that question because I kind of think it really kind of like, wow, what would we do? And how could we do it? So, and then from there, once you have that leadership buy-in, really talk up to the staff and the supporting volunteers, which could be, your internal and external stakeholders. It could be your board members. It could be your clients for that matter. What is it that you would like to see? What is it that we don't have the resources to do around here now? What more could we be doing if we had more money, more people, more talent? What could we do? And challenge that idea of volunteers just doing what work the paid staff doesn't want to do. Volunteer roles have to be meaningful. They have to be impactful. And volunteers can give you the skills that the agency can't afford. I was working with a young man just recently who is getting his master's degree. He his specialty is change management, process improvement, strategic planning, and he's helping a small clinic in a rural community develop their strategic plan. Like, how are they going to grow? And then he was able to help them connect with other resources. And so in essence, this skilled volunteer, this wasn't something that they could pay somebody for, but he holds a really big job here in the state, and he's doing this as a volunteer. So he's bringing all that talent and all that skill, and he's just going to give it away free to help that little organization. And then he actually has a big project he has to do for his master's program that he's going to do it over there, and it's going to be worth thousands of dollars in savings to that organization. So think about that. Think about what the potential of professional skilled volunteers are. And I have a slide here to kind of give you some ideas on that. And then, that question, what could we accomplish with unlimited resources? And then here's the other thing. Knowing what your organization's vision statement is. The vision statement is for a future state. Something like, if you're with the Cancer Society, you want to live in a world with no cancer. How do you get there? If you are a food organization, your vision may be to eliminate hunger. It probably is. So how do you get there? And those kind of thinking big, dreaming big, pushing the envelope, you may be able to find volunteers that can help get you closer to imagining that vision. I have a program that I support. It's the CERTs. And one of the things that we've been working with state CERTs, local CERTs teams about is about installing fire detectors, working smoke alarms, CO2 detectors. And they've been doing this in communities, and we're seeing there has been a reduction in fatal fires as a result of that. So they're literally saving lives, and all they're doing is going and putting up a new smoke detector. So think about that, and think about, there's a prevention council that I work with on that, and they never want to see, firefighters never want to have a fatal fire, but we've been able to reduce it by 20%. I mean, that's huge, because that means that somebody is still around for their family versus, the alternative. So understand where the gaps are and the challenges are for your organization, and where can you slide volunteers in to meet that gap and size it up. That was one area where we were able to do that. So here, now we're going to think big. You think about this in terms of, I've talked a little bit about a professional volunteer, but what if you could really chart the future vision of your organization by also supporting board and committee appointments? It's a great way in terms of your influence as in volunteerism to think about how do you give your organization and marginalized communities, marginalized voices, a voice at the table. So think about that with board and committee appointments, where you're going with your volunteer roles. Strategic planning. You may have, like that young man that is helping that clinic out, you may have an opportunity to do that. Evaluation roles. You know what? You can find people who are so smart and so good at evaluation to do an evaluation that you couldn't afford to do in terms of the long-term impact of your programs and things like that. Think about that. If that was a volunteer, that would be a huge cost savings. And then the task that brings sustainability to initiatives. I've talked a lot about that. Advocacy. There is something that is so powerful about having a group of volunteers that are passionate about your cause. Let's talk about, is it Ben, who is in that little community? What was your, what was, oh, you're on mute. I'm sorry. But he's advocating for marginalized.
Adrian, I'm sorry.
Adrian, yes,
Yes,
Adrian.
Adrian,
Oh my
Michigan.
gosh.
I'm always surprised by anybody that even knows where that's at sometimes, so don't feel bad. It is a little
I
community.
just couldn't remember it. I was thinking Calhoun County, but I knew that wasn't right. But Adrian, who knew 25% of the population is Spanish speaking there? I mean, that to have advocacy to talk about things like resources for the schools, for their students, even having things that are in their language. I mean, that's huge. But it's very powerful to have volunteers be able to do that. And then fundraising. Sometimes, you don't have to be the one who has the expertise. You can have volunteers that have the expertise and those connections be able to do that. And that's extremely powerful, having the volunteers that are able to bring people together. Marketing, grant writing, technology. I'm working with a school who likes to go into high crime areas, and they work with young people to give them big time computer skills and cybersecurity, and also in like things like Microsoft accreditation of something. I don't know, it's beyond me. But anyway, these are really high paying jobs. And the guy is a veteran, and he says, my idea is, why would they need crime if they could make more money having a job, and a highly sought after job? So, I mean, I think that's really cool. But he turns around and he helps organizations, community centers, things like that, build better technology with his students. So I think that's a win-win. A couple other things, financial stuff. Doing audits, doing asset protection, things like that, liability scope, event planning, client feedback for improvement, kind of facilitating those kind of things, employee match for money. if you know the organizations that do that, you could go out and start recruiting their volunteers or their employees to serve in your organization. Consumers is one. The Gap is another one. So those individuals, they just sometimes need to be asked to volunteer. And then, but it brings in extra funds for your organization. Client follow-up and providing some guidance. You know, we did this with patients where there was someone who would just call and help them after an appointment. They were appointments that tended to get missed or they didn't follow up on their medications, but they would have a buddy, a mentor that would help them and that they would work through any challenges that they had in terms of like getting to their appointment or getting the medication refilled, things like that. And they found that there was higher compliance and better health outcomes from those people. But they were done by volunteers and they were not doctors. They were just regular people that would express care and concern and then help them with those resources. Then process improvement facilitation, developing policies and procedures, and human resources. You may not have the access to, you know, some of the best in that area, but you know what? A lot of times they will volunteer for you. And legal is another place. There's a lot of attorneys that do pro bono work, and they can help you with those kind of issues. Any thoughts on that real quick before I move on? Okay. So besides the handbook, the most valuable document that you have is that position description. And it details the work, the requirements, the experience that's needed, and what the volunteer should be able to expect. It should definitely reflect what their experience is going to be. And it guides the interviewer's conversation to get the best fit. And it protects the organization. So if there's something that they did that was outside of that and it opens you up for liability, you have that position description that can say, you know, they did actually do this on their own. This was not what was in their position description. And you'd have the follow-up and the details in terms of, you know, how you reminded people, you know, review your position description, look at that, understand what that details. So what should be in a position description? The position title, who's that person's supervisor? Sometimes you might have levels of supervision. Ultimately, you're their supervisor as a volunteer contact, but they may work with a program officer or a program coordinator. And so that's one level, but ultimately it's probably you. What is the goal or the purpose of the position? Every position should have a purpose. And it's just a summary of the impact, why it's important, and then the major responsibilities. I would always put the time commitment as well. You know, if you need somebody who's there once a week or it's twice a month, it's 2 to 4 hours, I think that is also a really good thing. What are any organizational requirements? Sometimes it could be that, you know, maybe they needed to be vaccinated against COVID, or maybe they need to have a criminal background check. You know, it could be just about anything, whatever your organizational requirements are. If you have some organizational behavior requirements, like, you know, a commitment to diversity or a commitment to safety, yeah, I'm just making these things up. Those things could be in there. What are their qualifications? So if you're a professional, you're seeking a professional volunteer, you're looking for someone, if like, let's go legal, your qualifications are they need to have their law degree and be in good standing. But if it's something that you could teach them, then their qualifications are that they've completed the training. And then you could talk about the training, the preparation that might be required. You could talk about the work location. What are the benefits to them being a volunteer? What's the benefits of this position? I had, when I was in healthcare, I would have positions that would be skill building. They would be more for social. They would be more for back, off stage. And then there would be some that would be patient and family support services. And so it could look at different motivations for people. So if they were someone who had felt isolated and they needed companionship, I'm probably not going to put them in an office by themselves, but I might put them somewhere else that'll kind of guide where that's going to go. And then those benefits to the volunteer. Some of the benefits are, they're maybe the same across the board. Maybe you have a discount, maybe you have free parking, you have access to training, you have access to, um, um, discounts. It could be anything. And what are the physical requirements? I think this is really important. If you really expect someone to be lifting things, lifting 25 pounds unassisted or pushing something, or there's a lot of bending involved, those are things that you want to put on there right on the onset. And the reason why is because let's say you have somebody who comes in a wheelchair and they obviously there's some things that they can and can't do, but they're hard to set on something. They don't meet those physical requirements. So what are some other things that we could do? So it can kind of guide those conversations. And then always having revision dates as a best practice, which, as I said, you have to look at what works for your organization. Every year to 2 years. I never let it go more than 2 years, but the revision dates were on the bottom. And then if we ever had to retire a position description or a role, we would have a retirement date on there. And so, go ahead. Did you have a question? Okay. Okay, so should every role have a position description? Yes. I think this is important for board roles. I think it's important for committee roles. I think it's important for even a one-time. And you may not get everything in that position description the first time you learn that there's nothing wrong with that. I've been doing this for 25 years and I had to continually kind of massage these sometimes as well, especially if it was something new. And then should it be dated and reviewed on a schedule? Absolutely. Should the document be given to the volunteer? Yes. And whenever it was revised or added to or changed significantly, that would also get shared with the volunteer. And then should the position description be available online? My thing is yes. You may find that that's different, but I always found that if volunteers could look at that, it tended to get them in the door a little bit more. And it was a nice way to reduce paper and things like that. But when they would come in for the interview, I would actually hand them that piece of paper. So you can do what you think is best for your organization, but I found that having them have that position description was always very helpful. Let's see. So there's some other resources I want to share with you. I'm going to send some things out that are going to support your learning today. I'll send you a sample position description, a few other things there. And then if you're looking to stay connected with us, I wanted to share this with you. This is our website. And then also we have a .gov delivery that sends out things about funding opportunities and about upcoming trainings, things like that. And then you should also make sure you're on our MyServes website, your organization, because I know some of you said that they were newer organizations. When I send that follow-up, I will send that address to check that out. And you should also check out our Galaxy site. It's a statewide site. We have about 13 to 14,000 people who are active volunteers that are in there, and you can always advertise your position descriptions and advertise your needs in there. And then also you can use that as a volunteer management database, which I have training on. How do you use that? So I'm going to stop the recording here. But I wanted to, oh shoot, what did I just do? I wanted to ask if there's any questions, if there's any